Hello, my friends. I am back with an empty whiteboard by request. I have had someone ask, what do I do during imaging? Because rehab ultrasound imaging for the lumbopelvic region is an emerging technology that is not yet widely accessible. I'll put it that way. It is available, but the technology is not cheap. And there is a maintenance kind of cost to that as well. So without diving into the cost of what it takes to do imaging as a pelvic and ortho PT, I just want to talk to you about what I do with that. If you are struggling with any problems between the voice, the respiratory diaphragm, and the pelvic diaphragm, which actually extends all the way down to the plantar fascia via the fascia, then you can benefit from ultrasound imaging. Now, I want to just say, this is a disclaimer statement. I am not an artist. Ask me to sing, I will sing. Ask me to draw, and I apologize. Because if drawing or singing, I could not carry a tune here. So that's my disclaimer statement. And now I'm going to explain to you why it is beneficial, I believe absolutely essential, to find a therapist who can do ultrasound imaging. Here's why. When you do something called transperineal, so we'll just call it TP for short. TP for short. When you do transperineal imaging in females, okay, and again, this is very rudimentary. I'm gonna draw it for you in real time and so that you can hopefully see it. So we have the tailbone here, and we have the pubic bone here. I know, I'm not great at drawing. And then your bladder should kind of look like a golf club head, kind of like this, right? If you don't have a uterus, but you have a cervix, that would be it. And if you had a uterus, it's kind of like this and then comes on down. But you know, on imaging, you're not going to see the vaginal canal because it's just a space unless something's in it, right? So you're not going to see that part on imaging. And then you have the anal rectal canal. It looks like this. Now, these kind of all lay together, stacked, right? When I'm measuring via imaging, I draw a line literally between the two bony, the pubic bone and the coccyx, between those two bony spaces. Call that the PC line. So here's your PC. That PC line, there are measurements, and so that are relatively standard if you dive into the literature that talk about where the bladder should sit, where the anorectal canal should sit, all kinds of fun stuff that nobody talks about. But if you can't pee or poop, right, there are people out there that are maybe catheterizing themselves or giving themselves colonics or enemas in order to try and go. That's tough, and it shouldn't have to happen that way. But if your pelvic floor is too tight, this is oversimplification, okay, it's much more complex than this. But if your pelvic floor has too much tension in it, nothing's going in, nothing's going out without pain or dysfunction. And so the first thing that we measure is there's a standard between these two lines here. It shouldn't be too big. If it's too big, internal organs can kind of fall out, right? So I'm trying to keep my lighting consistent here. There we go. So we're going to measure the distance between here and here. If the bladder, B for bladder, right, gets too low, you leak, right? So I measure this distance here. And if the bladder is also too floppy or too mobile, then that can impact how the cervix here also drops. Okay, that's called pelvic organ prolapse when these things start to drop. But it also can create leakage. It can also create pain, painful intercourse, pain just sitting around doing nothing, pain trying to walk, pain when you hit mile 5 running, or leakage, right? There's a lot of different things that can happen. The last thing that we measure here is the anorectal canal. The anorectal canal should have an angle of about 120 degrees, okay? So this angle here, when you try to poop, it should go straighter, right? If you have a prolapse, it could be that the anal rectal canal kind of bumps into the structures over here, like the bladder, the vaginal wall, right? That's called a posterior wall prolapse. And so we measure that because this 120-degree angle right here should get straighter as you try to poop. If it doesn't, I can see that. We measure it. We work on fixing it, right? So if you struggle with lifelong constipation, this can help. Imaging can help. If you struggle with going to the bathroom too often or not being able to empty the bladder in the way that you think because you think you're done, but then you're not, imaging can help. If you're having painful intercourse, imaging can help. If you have hip pain, pelvic pain, a core that doesn't seem to be quite online. I've heard people also complain like they feel like with hip issue or a hip arthroscopy issue, it feels like they've got kind of a dead butt. Things don't really work as well as they used to. Imaging can help. Now, this is just one. This is just one of the ways. Transperineal, okay, that's your TPUS is what we call it. That's what we measure here. And so I take all these measurements into consideration before I prescribe any kind of PT, which could include integrative medicine, functional medicine, lifestyle medicine as approaches to the way that I use PT. But all of what I do is very much informed by these objective measurements in imaging. If they don't come out right, well, literally nothing's coming out right in terms of bowel and bladder. So here's what can happen if the pelvic floor is too tight. It's hard to get things in and out of the vaginal canal. It's hard to get pee out, right, with the bladder. And if the pelvic floor isn't acting correctly, then what you can end up having is an angle. Let's get rid of this. An angle that kind of looks like you're pushing uphill because this cute little angle right here kinks too much. It could either push back, like I was mentioning over here, or it actually ends up kinking so much that it feels like you're trying to push uphill and around a corner to get the poop out. That's not sustainable, right? So you could end up having constipation and bladder issues, painful bladder syndrome, things like that. Endometriosis can impact all of this as well. So don't let anyone tell you that your bowel bladder function and your gastrointestinal function has nothing to do with, uro and gynecological, issues or endometriosis. It absolutely does. So I hope this is helpful. This is one of the ways that I measure. There are many other ways, respiratory diaphragm, transabdominal in multiple different ways that I can go into later. But this is just how I address transperineal ultrasound in lumbopelvic rehabilitation as a pelvic and ortho PT. Thanks for watching. And if this is helpful, subscribe for free, share it with a friend. Leave a comment. I'd love to hear it if you have any questions. Again, I apologize for my rudimentary drawing. When I do imaging, it's actually much more clean than what you saw here. So again, I hope this is helpful and don't hesitate to reach out. I do a limited number of free consults, but I can't free consult the world. But if you're having significant issues anywhere between the voice, respiratory diaphragm, and the pelvic floor, and people are telling you it's not connected, it is. We can measure it, we can see it, and we can help.